So truly what I'm going to give you today is our recipe that we give to our patients to guarantee that they're going to get the range of motion outcomes that they want, which really jump starts the rehab process to give them the best outcome 5, 10, 15 years later. Gaining that range of motion right from the get-go is essential, and this is how we do it. So the first thing that we do is we talk to the individual about the importance of their range of motion. People really need to know the gravity of the situation, that if they don't regain their range of motion, they could have lifetime disability from this. So it's important that we're consistently pushing through the parameters that we give them at home to gain the motion necessary to be able to push to other levels in strengthening, balance, coordination. So the first thing that we go into is their range of motion. We have certain goals. We need them within the first 6 weeks to get 0 to 125 degrees. The second goal is for them to start developing a good quad contraction, that's a muscle in the front of their thigh, and to demonstrate that they can accept weight onto their leg with a normal gait pattern. In that first 6 weeks, we want to get people back to eating a regular diet, preferably proteins. And that's important when I say preferably proteins, because those are the building blocks for muscles, tissue repair, and other. And what just happened to your total knee? They completely cut the bone off both sides and rammed a metal component into the joint on both sides. And they had to push and pull a lot of tissue out of the way, muscle, ligament, connective tissue to get to it. So that protein is going to be important for the building blocks to those tissues. But you want to get back to a normal diet, because a good caloric diet will also give you the energy that you need so that you can continue to push in your range of motion exercises and just general stamina overall. The last little bit is pain management. Pain management is critical. And I know that a lot of the narcotics are being really reduced, which is good. A lot of people became addicted to narcotics, but they are also an effective pain reliever. So in order to gain the amount of motion that you need to be able to manage your pain. And that may be that you take your narcotics the way that they're prescribed. Once you get to a point where you don't need to continue to take narcotics and you can get away with an over-the-counter Tylenol, then good. But if you can't push your range of motion in the way that you need to because you're developing pain to the knee with every push and it's unrelenting and you're not able to push through your range of motion the way you need to, you're going to have a poor outcome. So taking your pain medicine might be the essential tool that helps you gain that motion initially. And the last little bit of sleep. We really talk about sleep because without proper rest, without proper energy levels, then you're going to get fatigue mentally as much as physically. It takes a lot to sit at home and keep pushing your range of motion into pain to give yourself a better function 6, 10, 12 weeks to years later. So it's important that you're getting good quality sleep. And I hear this all the time. Well, my nurse at the hospital said I can't sleep with a pillow under my knee because it's going to create a contracture. Maybe. But what's going to also create a contracture is the fact that you're not able to push your range of motion the way that you need to because you're too stinking fatigued at home and you have zero energy, so you're not doing your exercises anyways. So here's the thing. It might be counterintuitive to some of you. Some individuals might not agree with my approach. But I tell my patients, sleep however you want. If you're going to put a pillow under your knee, do it. Because if that gives you comfort and allows you to sleep up to 8 hours, great. Because you know what we're going to do for the next 16 hours that you're awake? You're going to push that range of motion to get the knee as straight as possible, but also as bent as possible. And having that energy from good nutrition, eating preferably more proteins, by advancing your sleep, you're going to have energy. Heck, your pain might even come down because you're not as stimulated. And now you can push your range of motion that you need to. Because if you're for 16 hours doing everything that you need to in 8 hours you're not, overall you're going to win. You're going to win. You're going to gain your range of motion and you're going to advance forward in your rehab.